People Management Association of the Philippines.
Kaso nakamute pa rin. Okay. Magandang umaga po sa inyong lahat. Good morning, PMAppers, and to our viewers and participants. My name is Ellen Fulido from the FJ Elizalde Group and also your PMAP Board Secretary for 2020. Welcome to another series of webinars from the People Management Association of the Philippines. So for the past few weeks, we've been running webinars relative to the pandemic that we're experiencing right now. We're in ECQ pa rin, but we would be glad to take up other matters relative to this topic, no? Yung ating ano ang mga maaasahan nating tulong sa gobyerno lalo na ngayong panahon ng pandemic. By the way, we will have speakers from PhilHealth and also from ECC because our topic for today is Heal as One, COVID-19 assistance that we can expect from the government. Since we are, doing this webinar and we're physically distant from each other, there might be technical difficulties. You might encounter technical glitches, so bear with us. For the past few weeks, we have a total of almost 19,000 Zoom registrants. We also have weekly reach of almost 600,000 people and almost 150,000 YouTube live viewers. Masyado hong marami ang ating participants. We can only accommodate 500 participants at a time. So if you're not able to register, you can still view us live via YouTube channel of PMAP. We're also streaming sa Facebook, and you can type People Management Association of the Philippines or search for @official PMAP 1956. Don't worry, we can also be accessed, as I said, in our FB page. If you have questions, you may send them using the Zoom chat box. And for those watching on YouTube or Facebook, please post your questions in the comment section. Later on, we will be answering all your questions after each presentation. Kindly note that the presentation materials are one of the perks of being a PMAP member. For PMAP members who wish to have a copy of the slides, and for non-members who wish to be a member of PMAP, kindly send an email to RHEA, that's RHEA.paragsa@pmap.org.ph. So since we're excited about these topics, no? PhilHealth at saka ECC. Alam nyo, ito yung lagi kong sinasabi, even to our employees. Ito yung mga benepisyong makukuha mo na kailangan mo pang magkasakit or may mangyari sa'yo para makuha mo. But it pays to know that you are protected. So one of our speakers today is the head of the Public Affairs Unit of PhilHealth in NCR. And without further ado, I'd like to introduce to you our speaker from PhilHealth, Mr. Raymond Edwin Acoba. Virtual clap po tayo para kay Sir Edwin. Sir Raymond. Sir Raymond?
Hello. Hello.
Hello, sir.
Yeah, can you hear me?
Yes, you can be heard, sir. Pero wala ka pong video.
Okay. Here.
Yes. Go ahead, sir.
Hi, good morning to everyone. And thank you very much, Ms. Pulido, for inviting PhilHealth to join in your webinar. This is the first time that we're going to have a webinar with PMAP. And we are here to discuss about the benefits of PhilHealth. Okay. So I cannot show any presentation right now, so I will just do it verbally, no? So ang PhilHealth po, with the emergence of the coronavirus and with the COVID-19, naglabas po tayo ng package. It just so happened that during that time, since we all know that coronavirus is a new disease, wala pa talaga tayong package. So for a while na habang nagpo-formulate po yung ating PhilHealth, yung ating actuarial, and ating health finance, I mean, yung BDRD, yung Benefits Development Research Department natin about package for PhilHealth. What happened here is yung ating PhilHealth, naglabas muna po ng package for ito, nandito na pala yung aming presentation. So ito po yun, no? Yung full financial risk protection for Filipino health workers and patients against coronavirus disease. Okay. So ito yung outline of presentation natin, yung definition of terms. By the way, may I ask who is controlling the presentation po? So that I can request na i-click na lang agad. So there are certain para ma-shorten ko in 30 minutes yung 3 presentations ko.
Sige lang, sir. You can just say next slide because our PhilMap staff, professional staff are in control. Sila yung nag-admin.
Okay, so ito po yung outline of presentation natin. So we'll start with the definition of terms next, please. Next slide, please. So ito po ang definition, no? Universal definition po. So I'm pretty sure that everyone already is familiar with this one. Yung probable suspect case whom laboratory testing for COVID-19 is inconclusive. Number 2, probable pa rin to, suspect who underwent testing for COVID-19 but not conducted in a national or sub-national reference laboratory. Tapos yung number 3 naman po, suspect case for which testing could not be performed for any reason. So yung confirmed naman po, ito yung any individual irrespective of presence or absence of clinical signs and symptoms who was laboratory confirmed for COVID-19 in a test conducted at the National Reference Laboratory, a sub-national reference laboratory, and or officially accredited laboratory testing facility. Next slide, please. So health workers. Who are the health workers? They are the persons engaged in health and health-related work, regardless of employment status. So they include the following: the doctors, nurses, allied health professionals, administrative and support personnel in health facilities, utility and security personnel working in health facilities, health volunteers deployed in health facilities, and staff and personnel working in government health agencies. Next slide, please. So ito po yung current situation natin, no? As of January 30, we all know that the WHO declared a public health emergency. So ito po yung Philippine statistics, no? As of April 14 po ito. Next slide, please. So yung PhilHealth po, right now, meron na tayong bagong batas, no? This is the Universal Healthcare Law. So individual-based health services shall be financed primarily through prepayment mechanisms. So on last March 11, 2020, na-declare na po yung COVID-19 as a global pandemic. Tapos naglabas na rin po, no, noong March 24, yung Republic Act 11469, which is known as the Bayanihan to Heal as One Act Law. So ang sinasabi rito sa Section 4, letter E, direct PhilHealth to shoulder all medical expenses of public and private healthcare workers in case of exposure. Next slide. So ito po yung background on benefits coverage for emerging diseases. Okay, next. So ito yung existing equivalent PhilHealth benefits. Yung isolation package, referral package, and pneumonia cases natin. We have to remember that COVID-19 is usually associated with pneumonia. So ito po yung previews na PhilHealth benefits natin. Later on, I will show to you ano na po yung bago nating package for COVID-19. Next, please. So ito po yung naging problem natin with the emergence of the COVID-19. Wala pa tayong benefit package for testing. And yung case rate natin for pneumonia, which I have said is associated to COVID-19, is not enough to cover the full cost of care for COVID-19. Next, please. So with that, ang PhilHealth po nag-establish ng guidelines for the interim coverage of probable and confirmed COVID-19 case management. Next, please. So ito po yung scope ng circular natin. This circular shall apply to all Filipinos. Next, please. Okay. So ito po, no? Management of patients suspected to have COVID-19, meron tayong different classifications. Meron tayong community isolation, mild pneumonia, elderly or with comorbidities, moderate pneumonia, severe pneumonia, and critical pneumonia. Go on. Next slide, please. Okay. Next slide. Next slide. Next slide, please. Yes. Okay. But for a while, can we go back to the specific guidelines? Nalampasan natin yung important. Yung previous slide before this claims filing and reimbursement. Backtrack lang po tayo.
Okay.
Specific guidelines. Kasi nandun yung G's ng ano natin.
Team, one more slide siguro.
Ayan, the specific guidelines. Okay, I have to be clear with this one. But this is what, okay. Next slide. Dito sa specific guidelines natin, we have to mind of the period, no? So all Filipinos confined for probable or confirmed COVID-19 from the period of February 1, 2020 up to April 14, 2020 shall be eligible for the COVID-19 benefits for inpatient care with no co-payment, whether in public or private facility. Letter B, health workers, regardless of employment status, confined for probable or confirmed COVID-19 starting Feb 1 to April 14, no co-payment then. So I will be clear with this one. During the time with the emergence of the COVID-19, meron na po tayong mga cases na na-confine ng mga Filipinos na members natin sa mga hospitals. At that time, wala pa po tayong package for COVID-19 kasi pinag-aaralan pa nga po ng ating PhilHealth Benefits Development and Research Department or BDRD. So, ang ginawa po ng PhilHealth habang wala pa tayong case rate kasi bagong-bago nga po itong coronavirus or yung COVID-19, ang ginawa po ng PhilHealth, sasagutin mo na po ng PhilHealth lahat po ng gastusin pang-ospital ng lahat ng mga members natin na na-ospital during February 1, 2020 up to April 14, 2020 habang wala pang case rate. So, ang sinasabi na no co-payment, wala pong babayaran ang ating members kasi ito po ay sagot ng PhilHealth. Pero, kailangan natin tandaan, ito po yung mga date of confinement na pumasok sa period ng February 1, 2020 up to April 14, 2020. Again, klaruhin ko po, it's February 1, 2020 to April 14. So in other words, pagpasok po ng April 15, sakop na po ng bago nating case rate, under sa pneumonia case rates, yung ating mga na-hospital na mga members dahil po sa COVID-19. Okay. Let us say, meron baka later on may magtanong, what if kung hindi namin alam, nasagot pala ng PhilHealth yung gastusin sa pagpapa-ospital during the time na na-confine kami ng February 1, 2020 to April 14. At ang kaso ay COVID-19, makaka-avail pa rin ba kami? Yes, makaka-avail pa rin kayo, pero magdi-direct filing kayo ng reimbursement ninyo. Basta siguraduhin lang kayo po ay na-confine noong Feb 1, 2020 to April 14 because of COVID-19. Okay? So yun po yung gist ng circular na po ito. Baka may magtanong, bakit naman pagpasok ng April 15, hindi nasagot po ng PhilHealth lahat ng gastusin. Samantala ng Feb 1 to 2020 to April 14, sagot po ng PhilHealth. Kasi during that time nga po, nung Feb 1 to April 14, bagong-bago ho yung COVID at lahat naman po talaga tayo na gulat po sa COVID. Napakabilis ng pick up or yung surge ng COVID. So ang ginawa ng PhilHealth, kumbaga, ito po na yung temporary na ginawa. Sige, sasagutin mo na po ng PhilHealth as long as na-confine ka Feb 1, 2020 to April 14. Kasi pagpasok po ng April 15, naka-develop na po ang PhilHealth ng case rates. Pero malaki pa rin po yung benefits o yung case rates na binigay po ng PhilHealth. Again, when we're talking about this circular, ito po yung Feb 1 na admission po na Feb 1, 2020 to April 14. Pag siya ay na-confine po ng April 15, hindi na siya covered ng circular na ito. Okay, next slide please. So ito nga po, all staff and personnel working government health agencies shall be eligible for the same benefits. Actually, all Filipinos shall be eligible po dito sa circular na ito. Next slide please. Ayan yung claims filing and reimbursement. Next please. So all claims shall be filed by the accredited healthcare provider. There shall be no direct filing. Pero alam po natin kasi, yung ibang mga members natin, hindi sila naka-avail for the reason na they are not aware, or even the healthcare providers were not aware of this circular. So with this circular, pwede na po sila. Next slide, please. Okay. I guess we're okay na with this one. Yung with this circular. Because yung the others, trabaho na rin po ng PhilHealth. So what is important here is we have to remind our employees, our members, yung mga key yung mga key messages na kailangan natin malaman. Dito sa circular na to, first of all, dapat na-confine siya ng Feb 1 to April 14. Next, no co-payment, which means sagot po ng PhilHealth yung gastusin pang ospital related o associated with COVID-19 for these cases na April 1 to Feb 1 to April 14, 2020. Third point here is, for example, there are instances na hindi kasi alam ng member or even the healthcare provider hindi alam na meron ng ganito. Do not worry, meron pa naman chance na maka-avail ng PhilHealth. So in other words, retroactive yung ang circular na to as long as within the period ka, yung Feb 1 to April 14 confinement. Okay, can we go on to the other presentation natin? So this will end yung ating discussion regarding sa full financial. So we go now to the new case rates for pneumonia, which is associated with COVID-19. Kasi ito yung Feb 1 to April 14. So let's talk about naman what will happen naman dun sa mga members natin or Filipinos na na-confine April 15 onwards. So ito na po yung di-discuss natin na next presentation natin. So may I request for the presentation to be presented sa screen. Ayan na po. So ito po yung benefit packages for inpatient care of probable and confirmed COVID-19 developing severe illness. Okay. Kwento lang po. So yung outline of presentation, case definitions, current situation, rationale, identified gaps, objective scope, general guidelines. Pare-pareho lang po yun. So can we go straight na po dun sa general guidelines? Sa general guidelines. Okay, next slide. So sa general guidelines, all Filipinos shall be deemed eligible for any of the COVID-19 benefits for inpatient care. Filipinos who are currently not members of PhilHealth shall be automatically covered provided that they complete member registration prior to discharge from the facility. Okay, sa letter A, it's very clear that all Filipinos, whether he is not a member or a member, shall be covered by PhilHealth. Okay, so all Filipinos shall be covered. Letter B, single period of confinement and 45 days annual benefit limit shall not be applied in this package. So just in case na lumampas po siya ng 45 days yung member or yung Filipino, yung patient, makaka-avail pa rin siya ng benefit package. Next. Letter C, all COVID-19 benefits for inpatient care shall have no co-payment from the patient for direct healthcare services, both for private and public healthcare providers. Patients can have co-payment for amenities such as suite room accommodation. So ito po, ang mga health workers po, no? This pertains to the health workers. Thus, data sharing of patients, suspect, probable, and confirmed cases of COVID-19 shall be done between the DOH and PhilHealth to develop a comprehensive patient registry. Letter E, all items donated by third parties shall not be charged to the patient. So let's go na sa benefit availment. So get ready with the benefit availment. This is very important. So April 15 onwards, ito na po ang case rate na binibigay po ng PhilHealth. So this depends upon the assessment of your healthcare provider or the hospital or of your doctor. So check nyo po in severity, no? So kung mild pneumonia po siya in the elderly or with comorbidities, ang case rate natin is 43,997. Kung moderate pneumonia po siya, ang case rate natin is 143,267 pesos. And kung severe pneumonia po siya, 333,519 pesos ang package rate natin. And lastly, kung critical pneumonia po siya, makaka-avail siya ng 786,000 pesos, 384. So ito po yung package rates na na-formulate po ng ating PhilHealth BDRD, no? So ito po yung binibigay po natin na package rate. If you would look yung previous package rate natin with pneumonia, it was only fixed at 15,000 for moderate pneumonia. Pag severe pneumonia naman, it's fixed at 32,000. So as you can see with the new package po with our pneumonia, talagang tumaas po, no, yung ating package. This is primarily because of the COVID-19, with the emergence of COVID-19. Kasi pneumonia is associated with the COVID-19. So again, ito na po yung ating mga package rates natin. So it ranges from 43,000 pesos to 786,000 pesos. Next. So ito po yung mga notes para sa ating mga healthcare providers, so we can skip na lang this one. Next. Okay. Ito yung mga for critical pneumonia. So additional necessary medical services for cases that develop or with impending severe illness, which include but are not limited to the following, shall be covered by this benefit package. Yung acute respiratory distress syndrome, septic shock, requiring invasive ventilation, requiring extra corporeal membrane oxygenation, and requiring renal replacement therapy. Next slide, please. So ito yung mandatory services. The following are the mandatory services, inclusive of professional fees, accommodation, management and monitoring of illness, laboratory, diagnostics, imaging, medicines that are included in the guidelines and protocols, supplies, and equipments. Next slide, please. So claims filing and reimbursement, the usual po, all claims shall be filed by the accredited healthcare provider. So in other words, automatic deduction po, no? And there shall be no direct filing by the PhilHealth member. In any case that you have a problem, for example, the accredited healthcare provider will not reimburse your PhilHealth benefits, please let us know. Please call PhilHealth so that we can coordinate with the hospital. Okay? Next slide, please. So these are the ano rin po sa claims filing reimbursement. What is important here for our members, for our employees, and to our listeners, remember that automatic deduction po dapat to as long as you are confined in a PhilHealth accredited hospital. And as said naman po ng circular ito, all Filipinos, whether you are not a member or even if you're a member of PhilHealth, you can still claim po dito. But since na-employed po tayo lahat, definitely all of us are members already of PhilHealth. Okay, so we can go on na po sa ating next circular because I'm only given 30 minutes. So bibilisan ko na po yung last. Yung last naman po, it's about the testing. Oh yeah. Okay. Okay, so I guess we can go right away dun na po sa sa case availment po. There's objective. Oh yeah, benefits availment. So again, all Filipinos who are classified as eligible for testing by the DOH as well as the DOH confirmed COVID-19 case that require repeated testing can avail of the benefit package. So Filipinos who are not registered in PhilHealth shall be automatically covered. So the single period of confinement again is waived. Next slide. Next slide, please. Ito. So sa benefits availment, meron din tayong package for testing. So all services for the testing are procured and provided by the testing laboratory. So in other words, lahat po ito, sagot po ng laboratory, ang case rate natin is 8,150 pag pumunta kayo sa isang testing center na ginamit yung test kits nila. Pero pag yung test kits po ay donated to the testing center, yung rates natin is 5,450. And lastly po, pag yung test kits naman ay donated to the testing center, and yung cost of running the laboratory and the RT-PCR machine for testing is included the facility budget, the rates naman po is 2,710. So yung ating rates dito will depend upon the testing laboratory, testing center na pinuntahan po ng isang Pilipino, isang member. So marahil marami magtatanong sa inyo mamaya which testing laboratories are already accredited by PhilHealth. As of now, ongoing po yung accreditation natin with the mga testing laboratory or testing centers natin. But I can say na sa ngayon po, ang sigurado lang na accredited tayo ngayon yung sa Medical City. Sa NCR po ito. Sa Medical City po, sa Heart Center, and sa Lung Center. So these are the 3 hospitals na as of now na accredited. Pero minamadali na po ngayon ng PhilHealth yung accreditation of other testing laboratory or other testing centers. And do not worry, once na lumabas na po yung mga accredited testing centers natin, we will post it right away through our website, through social media, and other mediums po. Kung para mapaalam na natin o mapapublish natin yung mga testing centers na accredited na po ng PhilHealth. So that lahat po tayo makaka-avail ng mga case rates na ito. Okay, so those are the benefits which nilabas po ng PhilHealth during the time of this global pandemic. And I hope na I have given you proper information. And if you have any questions or clarifications, I guess later on during the open forum, we will try our best to answer your concerns. Thank you very much, PMAP, and thank you very much for all of our listeners and all of the employers who are listening right now and all keep safe. Thank you po.
Okay. Maraming salamat sa inyo, Sir Raymond. May gusto ko lang sabihin to, gusto ko itong i-share. Kasi simula itong pandemic na ito, Kahit kami nataranta kasi we're
Yes.
in the broadcast industry, taga-media po kami. So highly exposed ang aming mga tao sa field. In the middle of March, after the ECQ was implemented, I already have 3 patients, COVID positive. So since we have accredited medical centers, hospitals where we have a line, may credit line kami, definitely as part of the benefit of our employees, we have to send them to our accredited hospitals. Worried ako bilang head ng HR because the bills were running high already. And at that time, when we checked with the hospital, they said that wala pang guidelines ang PhilHealth. So what we know is we can just cover 15,000. So I was expecting that the bills per person would run by the millions, considering that one of them even got intubated, na ICU, etc., etc. So malaking bagay nung nag-announce kayo na patients who were admitted February 1 up to April 14 will be covered by PhilHealth. Nakahinga ako ng maluwag doon, sobra. Kasi napakahirap. Although sabihin na natin na this is part of our employees benefit package, hindi siya budgeted eh. Di ba? Parang magugulantang ka na, naku, paano to? And you have 3 already. Ang napakahirap i-manage. So malaking bagay at napapasalamat kami na naglabas kayo ng ganong guidelines na i-cover nyo until April 14. Incidentally, I still have patients in the hospital being treated. No? May question nga po eh. Sabi natin, mako-cover ang mga pasyente, Filipinos, whether members or not. No? Pero ang sabi dito, kung hanggang April 14 lang yung ating cut-off, paano po yung mga na-admit ng na-cover siya between Feb 1 to 14, pero hanggang ngayon ay nasa hospital pa rin? Mako-cover pa rin po ba ito in full ng PhilHealth?
Hi, ma'am.
Yes, sir.
The period said dun sa circular is February 1 to April 14. And that's the reckoning period po, is the date of confinement. So
Okay.
if one has been confined po siya April 13 or April 14, since pasok siya ron sa period na Feb 1 to April 14, covered siya ng circular na yon. So no co-payment lalabas yun. We have to remember yung date na April 15.
Okay.
April 15 onwards, pasok na siya doon sa existing benefit packages natin for pneumonia, from mild to critical pneumonia.
Okay. So para yun yung katanungan ni Ms. Ninfa Calera. So Ms. Ninfa, ang sagot doon, kahit na siya ay naka-confine pa rin ngayon, for as long as the patient has been admitted on or before April 14, therefore the hospitalization, the medical benefits covered by PhilHealth will be covered by PhilHealth nga, yung period na yon. So ang reckoning natin is hanggang April 14, sabi nga ni Sir Raymond. So any admission after April 14, ang i-apply na natin ay yung package na binuo ng PhilHealth. Meron hong question tungkol dun sa package. Ang sabi ni James Joseph Quaton, ask ko lang po kung ano po ang ginamit nyong variables para ma-arrive yung package rate per severity nung karamdaman or nung sakit. Paano daw po nabuo yung package? Like 49,000, 149,000? Paano daw po yun na-arrive? Ano daw yung ginamit na variables?
Okay.
Medyo technical na po.
It's a kind of technical na I need the help already of our Benefit Development Research Department or yung BDRD. I guess if so that we can go on, Ms. Pulido, can we park that question first? Then we will just take note of that so that we can give an explanation to yung nag-inquire po.
Okay.
Mm.
Alright. Team, medyo nawala si Sir Raymond. Sir Raymond, may question dito, isa pa. Good morning, Sir Raymond. I just want to confirm that regardless of the number of their contributions and when it was paid, PhilHealth members may avail PhilHealth COVID-19 benefits and inpatient care. Kahit daw po hindi pa bayad, hindi po kumpleto ang contribution, sila daw po ba ay mako-cover kung sakasakaling sila ay COVID positive at na-admit?
Yeah. Okay. Can you hear me?
Yes, yes. Go ahead, sir.
Yeah. In this case po, since na we are in a very extraordinary time, no? Tapos nilabas ng circular, covered pa rin po siya. Kung meron pong mga arrears or interest or yung mga ano, babayaran nyo pero later on pa po yun. Pero as of now, as long as ma-confine si Filipino because of COVID-19, makaka-avail siya ng PhilHealth case rates po, benefit packages po.
Okay. Ito ay hindi po tanong. Ito ay isang pasasalamat. Ang sabi dito, on behalf of my friends who got confined, I want to say thank you to PhilHealth. Their bill was 1.5 million but was shouldered all by PhilHealth. So maraming salamat daw sa pag-shoulder. Kaya ko, malaking kaluwagan para sa amin na even if we really cover our employees' hospitalization benefit, malaking kabawasan para sa amin, lalo na hindi budgeted yung mga confinement na dulot ng COVID-19. Sir, meron pa po ba kayong gustong idagdag dun sa ating napag-usapan? So folks, PMAPers and all our participants, gusto nating ito yung mga, again, let me just reiterate no na it pays to be covered. Ang hirap pong magkasakit sa panahon ngayon, lalo na itong pandemic na ito na we haven't had any solution to the problem. We don't have any vaccines. We don't have any cure yet. Hopefully, in the next few months, we will be able to get the cure. But until such time, yun yung lagi nating pinapakiusap. Stay home, stay healthy, be safe. Kasi nga po ay wala pang lunas. So, mahirap magkasakit sa panahon ngayon. So, hindi ho natin gugustuhin na magkasakit tayo kahit nasabihin pa na meron tayong benepisyong matatanggap mula sa gobyerno. So, sa mga kababayan natin, meron lang ho nagtanong sa akin personally. Medyo hindi ko lang alam kung if it's wise to ask kasi medyo na feature ho ang PhilHealth nitong mga nakaraang araw dahil sa reklamong natanggap mula sa mga OFWs bunga nung pagtataas ng ating interest rate by 3%, no? Although we've run a series of interviews in our radio station also, it might be good to let our participants know what can be done here, ano na ho ba ang stand, itutuloy or hindi itutuloy, lalo na't ito ay part ng Universal Healthcare Act, no? Yung ating Universal Health Law. So ano hong masasabi nyo dito dahil kayo ho ay laman ng mga balita at ng mga pahayagan nung lalo na at the start of the week and over the weekend, no? So
okay,
Raymond.
First things first, Miss Ellen. I would like to react din dun sa nagpasalamat niya na wala pong sinagot, no? During the time na confine ng Feb 1 to April 14. With that kasi, nabanggit to, I would like to quote our president na PhilHealth has sufficient funds. Okay? Tapos one of the mandate of PhilHealth is to protect the funds of PhilHealth for the future generation also. Pero dahil nga po sa pangyayaring ito na global pandemic and COVID-19, it's not about protecting the funds na, it's about protecting all Filipinos. That's why nag-all out po yung PhilHealth noong Feb 1 to April 14 for the meantime that we are waiting for the formulation of the new benefit package for COVID-19. Pero again, it was also stated by our President CEO, si General Morales, that although PhilHealth has sufficient funds, we do not have naman unlimited funds.
Correct.
Of course, we do not have unlimited funds. That's precisely the reason that by April 15 onwards, meron na tayong benefit package. na hindi naman natin kaya lahat sagutin forever. Yung ano, kasi talagang mabigat po yung sagutan. Pero I think that's a reasonable package already. From 32,000, umabot na to up to 700, more than 786,000 yung COVID-19. Para alam naman po natin yung PhilHealth is based on social equality, based on social justice.
Yes.
Para lahat po tayo ay makikinabang, especially the marginalized. Sabi nga po ng ating presidente na former president na si Ramon Magsaysay, ano po yung social justice? Those who have less in life should have more in law. Okay. So, yun po yung explanation natin bakit ho nagkaroon ng benefit package for COVID-19, which is the real practice naman of PhilHealth ever since. So, meron tayong fixed rate or case rate para sa mga, not only for COVID-19 but also all cases, no? All illnesses. So, yung reaction naman po natin, actually yung 3% na yan, siya po ay stipulated at nakalagay po yan particularly sa Section 10 po ng ating batas na Republic Act 112233 or the Universal Healthcare Law. Again, to our listeners, PhilHealth is the implementing arm of the Universal Healthcare. Hindi po kami ang nag-craft or nag-draft ng batas. We are just the enforcers, the implementors, or we just execute the law. And since na nakalagay po yan sa Universal Healthcare Law, we have to follow the law. Pinapatupad lang po namin yung batas, pero nangyari nga, marami pong nag-react dahil nga po masyadong mataas daw yung 3%. As of now, naglabas po kami ng official statement and I would just like to read yung
Yes, sir. Go ahead.
Yung last paragraph. It's only one paragraph so that we could explain our side, no, sa PhilHealth. So, PhilHealth recognizes that everyone is cash-strapped during these difficult times, and in the spirit of the recently passed Republic Act 11469 or the Bayanihan We Heal as One Law, which is government's response to the COVID-19 pandemic, PhilHealth has adopted a flexible payment scheme which will allow OFWs and all other direct paying self-employed members to pay their contributions within the year. As an agency of government sensitive to the welfare and well-being of all Filipinos, PhilHealth commits to continue exploring means to soften and alleviate the impact of premium rate increase. But it cannot change the law. PhilHealth does not have the power and authority to change the law, so we just have to implement kung ano nakalagay sa batas. Although marami na marami na usap-usap yan. Let us just wait po kung ano po yung ang mangyayari. Pero as on the part of PhilHealth, we are the implementing arm of the Universal Healthcare Law, so we have to enforce the law. And
so
even
ibig sabihin ba, Sir Raymond, nun kasi even Secretary Bebot Bello of DOLE binaril yung pagpapatupad ngayon Yan ba yung dahilan kung bakit nag-apply kayo? That's the reason why you applied a payment scheme over a period of months, ganun ba?
Okay. Probably, Ms. Ellen, let's just wait for the instructions coming from our management so that hindi tayo maka-steer of another controversy or anything.
Correct.
Because in itself, it's already controversial talaga and we want to clarify to the people. So, on our part po, we are just the messenger po. Messenger lang po tayo of the message. So, we just convey the message to the public. But until such time, kung meron po mga updates, we will let you know. And in addition to that, meron pa akong isang mensahe. I would just like to remind yung ating mga direct contributors, especially yung ating mga employers who are most of our audience right now, are employers, na in-extend na po natin yung payment for the premium contribution up for the months of February, March, and April. So it is extended up to May 31, 2020.
Okay.
With no interest. With no interest po yan.
Buti naman po. Kasi I am pretty sure na A lot of companies are having difficulty right now, no? In fact, some companies have closed already. Some have temporarily shut down and therefore would not have an income for a period of months. And even if we lift ECQ and we migrate to GCQ, we don't see a marked increase or a significant increase in the sales or revenues of these companies. So it would take quite a while for them to really get up onto their feet, maybe even normalize. Kasi ito na nga yung new normal eh. Ang new normal is medyo reduced talaga ang revenue for some companies. So apektado lahat. So yung pagpapalawig nyo ng pagbabayad ng premium ay malaking tulong para sa mga employers, especially our PMAP members who are also MSMEs, no? Companies.
Okay. Ms. Pulido, since that you have mentioned that there are other companies na nag-stop operations, yung iba talaga may mga skeletal workforce, meron kaming nilabas na advisory, payment of premium for all direct contributors. Ito po yun. It's a PhilHealth Advisory number 27 series of 2020. You can
so
check
meron yan sa website nyo?
Yeah. You can check it sa aming website. May nakalagay doon, yung third paragraph, it's 2 sentences lang, so let me read it. For employers implementing a skeletal workforce arrangement, please ensure that employees with no earnings or income are properly reported using the RF1 para hindi po sila magbayad ng premium contribution. And doon naman for employers who have temporarily stopped operations, please submit an electronic copy of a properly accomplished ER3 to your respective accounts officer para for the information naman po of PhilHealth.
Sir Raymond, may isa na lang question dito, no?
Okay.
Actually, dalawa. Una, yung unang question ay, we are a new business establishment and we just got our business registration documents a week prior to the declaration of ECQ. So the week before March 16 or 17, pending registration of our employees to PhilHealth, the ECQ was declared. So hindi pa nila na-declare. Can our employees avail of PhilHealth benefits related to COVID? How po? Hindi pa po sila registered sa PhilHealth, pero kunyari meron silang pasyente na COVID positive. Can they still avail? Parang kanina na-mention nyo, this covers all Filipinos, no? Regardless of member or hindi, no? So yun yung sagot dito. Regardless kung member ka ng PhilHealth or hindi, in this case, mas maganda nga because there was an intention to enroll them, to register them in PhilHealth. However, inabutan ng lockdown, inabutan ng ECQ, so they were unable to. But under the Universal Healthcare Act, all Filipinos are covered by the COVID-19 PhilHealth benefit package, di ba? At isa na lang pong tanong bago tayo ano raw ho masasabi nyo sa UST na nag-retrench dahil ang sabi nila isa sa mga dahilan ay PhilHealth owes them 180 million of past due accounts.
Okay. We wrote a letter already to UST. Kasi ang nangyari dito, meron pa rin silang mga denied claims, meron pa mga return to hospital claims. And actually ganito, year 2019 alone, okay? Nabayaran po sila ang USD ng PhilHealth claims around 320 million, more than 320 million for the year 2019. Tapos nung April 21, meron tayong interim reimbursement mechanism. Yung IRM or interim reimbursement mechanism, nagbigay tayo ng advance payment sa ating mga hospitals, not only UST. So para meron silang sufficient fund for their operations in response to this COVID-19 pandemic. In fact, particularly, UST April 21, they have received 82 million pesos as advance payment coming from PhilHealth. In order for them to respond nga properly at maka-operate sila ng maayos during the time na harapin nga natin itong pandemic na ito. So, meron pa silang mga claims na pending. Pending siya kasi it's still for validation. i-check pa ho ng PhilHealth at i-reconcile din po ng PhilHealth. Hindi naman agad-agad makukuha ng hospital without proper validation or dapat dumaan in accordance with proper policies and circulars. So kailangan po i-reconcile muna natin. Ang PhilHealth po ngayon ay nakikipag-usap at nakikipag-ugnayan ngayon sa UST para i-reconcile lahat po ng mga claims na they claim na hindi pa nababayaran para mas maayos po. Meron tayong tinatawag na RSM, Reconciliation System Module. Inaayos na natin ngayon yung Reconciliation System Module with UST upang maayos na po itong issue na ito. Okay? Ms. Pulido. Yes, hello. Hello.
Hello, sir. Sorry ha. Meron taga-broadcast kami pero may technical glitch ako.
Okay.
Maraming salamat po doon sa kasagutang mga ibinigay niyo sa mga katanungan. Very informative and marami kaming natutunan ngayong araw na to. May mga na-clarify. For those of you who are tuned in and you were not able to raise your questions, we were not able to address them in the interest of time, we have to manage the webinar. Please feel free to send in your questions. We will ask our professional staff to collate them and then we will reply to you via email siguro through our team. Siguro sir, at this point, maraming salamat po. Gusto naming pasalamatan kayo on behalf of the People Management Association of the Philippines, through our President Loy Echevarria and the rest of the Board of Trustees. Thank you very much for sharing your time, for sharing information to us, to our members and even non-members kasi malaking bagay po talaga. Paulit-ulit, ako pasalamat talaga ako sa inyo dahil with so many patients infected by COVID-19, di lang sa labas, dito mismo sa aming workplace, it's a big help talaga that we get assistance from PhilHealth at this point in time. So with that, let's have a virtual clap for Sir Raymond.
Thank you.
Maraming salamat po for your time. May audience ako rito sa studio na. All right.
Thank you.
I guess at this point, isa pang mahalagang benefit na makukuha natin sa government ay ang employees compensation. No? Ito pina-check ko talaga to. Sinabi ko to sa ECC. Incidentally, we're running a program on ECC every week dito sa amin. So, are we in? Ready na ba yung ating next speaker? Okay. So, yung ating next topic is related to another benefit given by the government, yung employees compensation. So, maraming katanungan. Kung may sakit ba ako, hindi ako nakapasok, I was on leave because I was confined. May makukuha ba ako? May matatanggap ba akong benepisyo galing sa Employees Compensation Commission, which is an arm of DOLE also? Anong meron? Anong para sa akin dito? So, to discuss these things for us this morning, guys, let's all welcome the Public Relations Officer 4 of the DOLE Employees Compensation Commission, Mr. Alvin Garcia. Virtual clap naman.
Hi everyone, good morning. I'm Saran, good morning. Yeah, before I proceed with my presentation, let me thank PMUP for organizing this webinar and for inviting us to be part of their activity. So let's start with the discussion with my topic, Employees Compensation Commission. I know a lot of employees, a lot of our workers, even employers are not aware of our existence. So I hope after my presentation, all our viewers, all our listeners will get a full understanding of what the Employees Compensation Commission is, right? So this will be my presentation outline for everyone. I'll be introducing to you our commission, I'll be discussing the Employees Compensation Program, ano yung mga compensable contingencies, compensable diseases, compensable injuries, what are the benefits employees may avail under the EC program, and our contact information if you have further questions and clarifications about the things that I will be explaining this morning. So, sobrang laking concern natin ngayon yung COVID-19. And the question really na nare-receive namin from our Facebook and from other platforms that we have is, can COVID-19 be compensable under EC program? So yan po yung sasagutin natin with our discussion this morning. All right, so let's start. Sino nga ba si Employees Compensation Commission or ECC? ECC actually is a government corporation or GOCC na tinatawag po natin. And we are an attached agency of the Department of Labor and Employment for Policy Coordination and Guidance. Okay? ECC is also one of our social security institutions, kahanay ng SSS, GSIS, Pag-ibig, and PhilHealth. The sad fact here though is every time nababanggit yung 4 social security institutions na yun, lagi nakakalimutan na may ECC pa pala. Okay? So si ECC, isa rin po siyang social security institution ng gobyerno na nagbibigay ng benepisyo sa lahat ng manggagawang Filipino. Okay? Most of the time also, whenever employers and employees hears about ECC, ang laging pumapasok sa isip natin is kami si SSS or kami si GSIS in the public sector. And we would like to clear that to everyone. ECC is a totally different agency from the 2 systems. And the benefits that we have are separate from the benefits that the 2 systems have for workers po. Okay? It's just that the 2 systems, SSS and GSIS, sila po yung administering agencies ni ECC when it comes to processing of claims ng mga employees natin. But again, the benefits that we have, they are different from the 2 systems. Okay? So kung titingnan natin, nabuo si ECC noong 1974. So for more than 4 decades now, 45 years to be exact, ECC has been in the government service. And again, sabi nga kanina, the sad fact here is a lot of employees are not aware of our existence. Okay? And us not knowing na may ECC pala, may EC program pala na pwedeng hingan ng tulong just in case magkasakit or maaksidente si employee because of work, it forfeits the purpose of the program. So we don't get to avail all these benefits, all these services. So napaka-importante, sabi ko nga every time I discuss ECC, na dapat we are not just well-versed of the work that we do. Dapat alam din natin ano ba yung mga ahensya ng gobyerno, ano ba yung mga programa ng gobyerno na nagbibigay ng proteksyon at serbisyo sa ating mga manggagawa. Okay? So ECC also has a quasi-judicial function. I'll explain later paano nag-work yung quasi-judicial function ni ECC. So the functions of our commission are as follows. One is to formulate policies and guidelines for the improvement of the EC program, review all claims denied by the 2 systems, and initiate policies towards an effective OSH accident prevention in the working environment. Okay? So this is the main purpose of our agency. It's to implement the Employees Compensation Program. So this is the core program of our agency. So ano nga ba yung Employees Compensation Program or ECP? Okay? So ECP is a program designed to provide employees and their families with income benefits, medical, and other benefits in the event of work-connected sickness, injury, or death. Okay? So ito yung pagkakaiba namin pagdating sa ibang mga social security institutions. Para makapag-claim tayo ng benefits kay ECC, the contingency na nangyari dapat must be work-connected. Okay? If it's not work-connected, then we only get to avail benefits from the systems, from PhilHealth and Pag-ibig. But if it's work-connected, there's another set of benefits that can be availed under the EC program. Alright, so sino ba yung mga covered ni ECC? Unlike PhilHealth na na-discuss si Raymond kanina, all Filipinos are covered. Sa amin, limited po yung coverage natin. In the private sector, lahat po ng mandatory members of the system, including OFWC-based and kasambahays, covered po ni ECC. Okay? The 2 last items, if na-notice po ng ating mga viewers, they are still in red. Okay? The self-employed and OFW land-based technically or legally covered na po sila ni ECC. But we have yet to fully implement the coverage of the last 2 items, self-employed and OFW land-based, kasi hinintay pa po natin na lumabas yung guidelines, approved guidelines from the system. Previously kasi, the self-employed and OFW land-based, hindi po sila pasok or kasama sa coverage ni ECC. So naglabas lang po ng resolutions ng bagong batas with the SSS reform law and ECC's endorsement to include or expand the coverage of EC program to self-employed, kaya po papasok na po sila sa coverage natin ngayon. Okay? But As of now, hindi pa po sila pwedeng mag-file ng claim kay ECC. Yung mga self-employed at OFW land-based po natin. So just to be clear with everyone, once lumabas po yung guidelines, that's the time na pwede po tayong mag-file at mag-file at mag-claim ng benefits sa programa po natin. Okay? In the government sector naman, lahat po ng mandatory members ng GSIS, automatic cover din po ni ECC. Okay? Including our uniformed personnel, such as the AFP, PNP, BJMP, BFP, and Philippine Coast Guard, lahat po sila pumapasok sa coverage ni ECC. Okay? So who pays for the EC contribution? Kasi ito yung isa sa mga laging tinatanong wala naman kaming, hindi naman kami nade-deduct or wala kaming contribution, kami mga empleyado kay ECC. Pumapasok pa rin ba kami sa coverage ninyo? Yun ang lagi na-receive namin na question. Okay? For everyone's information, the EC contribution po, it is not the employee's responsibility. Okay? It's our employer's responsibility to pay for our EC contribution. Okay? So yun po yung pagkakaiba namin pagdating sa ibang mga social security institutions. Kasi tayo mga empleyado, we don't pay a single centavo for our EC contribution. Okay? In the private sector, our employers, they pay either 10 pesos or 30 pesos per worker per month. So depende po ito sa salary ng employee natin. In the government sector, it's fixed. It's at 100 pesos per worker per month. Yung ina-allocate na budget po ng office natin for EC program. Alright, so as mentioned kanina, mga work-connected lang po yung covered ni ECC. Hindi po porque nagkasakit tayo, automatic entitled tayo to file and avail EC benefits. We need first to establish yung relatedness niya sa trabaho natin. Okay, so before I proceed with my presentation, let's watch this video about the compensability of contingencies under the EC program.
Nagkasakit o na-aksidente ka sa work? Oh no! Buti na lang, andyan ang ECC. Ang ECC o Employees Compensation Commission ay ang government agency na nagpapatupad ng ECP o Employees Compensation Program. Ito ay karagdagang benefits in case ikaw ay magkasakit o maaksidente dahil sa work. Pero kahit may ECC, laging tatandaan na safety should still be your top priority. Kailan nga ba maaaring mag-file at mag-claim ng ECP benefits? Number 1, kung ikaw ay naaksidente sa workplace. Number 2, kung ikaw ay naaksidente habang nagtatrabaho. Number 3, kung ikaw ay naaksidente kahit wala ka sa workplace dahil sa utos ng boss mo. Number 4, kung ikaw ay naaksidente papunta o pauwi galing trabaho. Pwede ka mag-claim ng ECP benefits kung walang diversion sa ruta mo papunta o pauwi. Dapat ay bahay, work o work, bahay lang. Number 5, pwede ka rin mag-claim ng ECP benefits kung ikaw ay naaksidente habang sakay ng company vehicle. Number 6, counted pa rin kung ikaw ay naaksidente sa activities ng company. Halimbawa, sa mga company team building at sports fest. At last but not the least, kung ikaw ay nakaranas ng assault habang ginagampanan mo ang trabaho mo. Kapag ikaw naman ay nagkasakit dahil sa trabaho, pwede kang mag-claim ng ECP benefits kung ang conditions of compensability ay nasatisfied mo base sa listahan ng occupational and work-related diseases. Pag ang sakit mo ay di kasama sa listahan, pwede pa rin ito maging compensable sa ilalim ng tinatawag natin na increased risk theory. Una, kung ang working conditions ay may health risks na nagiging sanhi ng sakit. Pangalawa, kung ang sakit ay nakuha mo dahil exposed ka sa mga health risks na ito. At pangatlo, kung nagkasakit ka kahit na sinusunod mo naman ang safety measures and precaution ng kumpanya. Samantala, meron naman tayong tinatawag na excepting circumstance o yung mga pagkakataon na hindi ka pwedeng mag-claim ng EC benefits. Kung ikaw ay lasing o lango sa alak o drugs habang nagtatrabaho at naaksidente ka, no yan. Hindi ka rin pwede mag-claim ng ECP kung ikaw ay nagpabaya o notoriously negligent ka kaya ka na-aksidente o nagkasakit. Halimbawa ay ang hindi pagsunod sa safety precautions ng kumpanya o hindi pagsuot ng protective gear. Hindi rin valid ang claim kung sinasadya mong saktan ang sarili mo o ang iba na naging sanhi ng aksidente o sakit. Bad yun! Laging tandaan na safety should always be your first priority kahit saan, kahit kailan, kahit sa trabaho. Kapag aksidente di maiwasan, don't worry! Andyan ang ECC to help you! For more information, pumunta lang sa pinakamalapit na ECC office sa inyong lugar. Remember, kahit may ECC, lagi ka pa rin mag-ingat ha!
Okay, so again, not all diseases are compensable under the EC program. Okay, tanging mga sakit po na work-related lang po yung binabayaran ni ECC. As of now, we have 32 lists of compensable diseases. ECC came out with the list because there's a high presumption already na yung mga sakit po na yun nakuha or nanggaling talaga sa trabaho natin. Okay, but as mentioned in the video, in the event, for example, that your disease is not included in the list of compensable diseases, such as the COVID-19, ECC employee may still file for EC benefits. Okay, gamit po yung increased risk theory na tinatawag po natin. Okay, we just need to prove na it really came from the work na meron tayo or from the working conditions na meron po tayo. Okay, so again, laging tinatanong, is COVID-19 compensable under the EC program? The answer is yes, especially for our frontline workers. Yung mga doctors, nurses natin, and even our uniform personnel, despite the pandemic, despite the crisis that we have now, is ginagawa pa rin yung trabaho po nila. Okay, so just in case they suffer, they get infected of the virus, or kahit PUI pa lang sila, entitled po sila to claim and avail benefits from the EC program po. Okay, so I'll be explaining later ba yung mga benefits na pwedeng makuha po nila. Alright, so but at least clear lang din, hindi lang po yung sakit yung binabayaran or compensable kay ECC. So na-mention sa video kanina, even accidents sa workplace po, covered po ni ECC. Kasi a lot of workers, a lot of employers are not aware na pag ganitong accidentally pala, may benefits na pwedeng makuha kay ECC aside sa SSS benefits na fina-file or kiniklaim natin. Okay, so isa yan sa mga dapat alam po natin. So again, for the injury and resulting disability or death to be compensable, the injury must be the result of an accident arising out of or in the course of employment. Okay, so I'm discussing now yung buong EC program para sa mga listeners and viewers natin para at least alam nila at aware sila na may ganitong programa, may ganitong benepisyo sila na pwedeng makuha just in case may mangyari sa kanila because of work. Okay? Alright, so let's now move to sa benefits na pwedeng makuha ng mga employees natin just in case they get infected of the COVID-19 if it's work-connected. Okay? Not just COVID-19 but other work-related contingencies, sickness, and accidents na pwede pong mangyari sa mga employees natin. So these are the benefits that we have. We have medical benefits, loss of income benefit, carer's allowance, death and funeral benefit, plus rehabilitation services. Okay? For loss of income benefit, under the EC program, it is not the illness that is being compensated. Okay? Pumapasok si ECC sa mga employees natin kapag nagkaroon na po ng loss of income. Kapag naputol yung earning capacity ng employee natin, that's the time na pumapasok po si ECC. Okay? But again, dapat may work-related accident or disease na nangyari sa worker po natin. Yun yung binabanggit ni Ms. Ellen kanina. Dapat nagkasakit or na-accident muna tayo because of work. Okay? We have 3 types of disability as well, similar to SSS. We have temporary total, permanent total, and permanent partial disability benefits. Okay? For temporary total, dito pumapasok in most cases yung COVID-19 natin. Okay? Ito yung mga pagkakasakit or pagkaka-accident that requires us to rest for a couple number of weeks, months, sometimes sa trabaho po natin. Okay? In the private sector, a maximum of 480 pesos per day yung pwedeng maklaim po ng employee natin. So depende siya dun sa average salary credit ng employee po natin. Okay? So it's paid from the first day of disability until such time na makabalik po yung employee natin sa trabaho. Usually it's 120 days yung ginagrant po natin for TPD, but it can be granted to 240 days if the employee really requires na ma-extend po yung pagpapahinga niya sa trabaho because of the contingency na nangyari sa kanya. Okay? So ito po yung equivalent ng sickness benefit ni SSS. So if it's work-connected, aside dun sa sickness benefit ng KSSS, may sickness benefit pa siya na pwedeng makuha from ECC. So nagkakaroon ng double recovery of benefits na tinatawag for our workers in the private sector. Okay, I'm saying in the private sector kasi sa public sector po, iba naman yung case. Because of the exclusiveness of benefits na meron tayo under the GSIS law, hindi po nagkakaroon ng double recovery of benefits. Yung mga workers natin in the government, okay, so pipili lang sila in most cases kung GSIS benefits or EC benefits po yung kukunin nila for directly the same benefit. Okay, but sa private sector, again, wala pong ganong klaseng batas. So pwede pong i-file pareho, sabay, yung SSS benefits at yung EC benefits ng mga workers po natin. Okay? For permanent total disability naman, ito yung for example, both of your eyes, nabulag, or parehong paamo, naputol, ganyan, at na-categorize ka as permanent total disability, for this disability ang nakukuha po natin dito, ang nakukuha natin most of the time is pension. Okay? Again, this is one of the benefits na hindi nakiklaim ng mga employees natin kadalasan. Kasi the moment they receive yung pension nila kay SSS, akala nila yun na yun. Not knowing if it's work-connected, there's another set of benefits na pwedeng makuha kay ECC. So aside sa pension na pwedeng makuha kay SSS, may another pension pa na pwedeng makuha si employee natin from ECC. So dalawang pension in fact, yung pwedeng i-file at i-claim ng mga beneficiaries natin, ng mga employees natin, if work-connected po yung nangyari sa kanila. Okay? We also have permanent partial disability. Ito yung isang body part yung naputol or nagkaroon ng function loss, one of your body part, nag-fall po tayo under permanent partial disability. Usually, monthly pension or lump sum pension yung binibigyan natin sa mga employees po natin. Okay, so aside from those disability benefits, so temporary total, permanent total, and permanent partial disability benefits, meron din pong medical benefits si ECC like ward services, during hospital confinement, medical attendance of a doctor, surgical expense benefit, and reimbursement of cost of medicines. Okay, so again, is one of the benefits na kadalasan hindi alam ng mga workers, ng mga employers natin. Okay? Nabanggit ni PhilHealth kanina, after April 14 or 15, packages na yung binibigay. Hindi na yung full coverage or full expenses yung sasagutin nila. Okay? So pwedeng pumasok po doon si ECC for employees na na-infect with the COVID-19 at na-classify siya na work-connected. Okay? So, for example, after yung allowable HMO, kung meron man si worker natin or yung PhilHealth benefits niya, if any of those two completely exhausted na for a particular confinement or consultation such as the COVID-19, yung out-of-pocket expenses ng worker or ng employee natin can be filed, okay, sa ECC for EC medical reimbursement. Okay? The amount of reimbursement, though, it should not be higher than the actual amount paid by the said employee in the prevailing rates prescribed by the Commission. So it will still undergo evaluation ng mga medical evaluators natin kung magkano yung pwedeng i-reimburse na out-of-pocket expense ng mga workers natin because of the contingency na nangyari po sa kanila. Okay? So pwede pong i-file yon kay ECC if it's work-connected. Alright, aside from that, we also have CARES allowance. The CARES allowance, it's granted to employees naman who gets permanently and totally disabled na. They are receiving 1,000 pesos allowance po. Okay? SSS also have these benefits for their members po. We also have death and funeral benefits. So yung mga frontline workers po natin, yung mga doctors natin na namatay because of COVID-19, they are entitled to file and avail death and funeral benefits po ni ECC. Okay? So aside from the funeral benefit in the private sector na pwedeng makuha kay SSS, I think for kay SSS it's ranging from 20 to 40,000 if I'm not mistaken yung funeral benefit nila. Aside from that, the beneficiaries of the deceased employee na namatay because of a work-related contingency such as the COVID-19, pwede po sila mag-file for funeral benefit amounting to 30,000 kay ECC. Aside from that, may monthly income benefit pension din na pwedeng makuha po yung mga beneficiaries po nila. So again, dalawang benefits yung pwedeng makuha in the private sector. Dalawang funeral benefit, one from SSS and one from ECC, plus 2 pensions po. Pension from SSS and pension from ECC. Okay? So again, ito yung mga benepisyo na hindi nakukuha ng mga empleyado natin simply because we are not aware of its existence. Okay? So it's very important na dapat alam po natin ito mga ito. Okay? We also have rehabilitation services for occupationally disabled workers. Aside from the monetary benefits na binibigay po ni ECC, sabi nga namin, we don't just provide monetary assistance to our claimants, to our clients. If they need follow-up services, okay, they can get that from ECC. Kung kailangan mag-undergo ng employee natin for physical therapy, speech therapy, occupational therapy, lahat po yan binibigay ni ECC ng libre. Not just therapy sessions, but even rehabilitation appliances, such as hearing aid, crutches, wheelchair, prostheses. Lahat po yan pwedeng ma-avail kay ECC. Ang requirement lang natin para ma-avail ng employee natin yung mga benefits na ito is one, dapat nakapag-file siya ng EC benefits. At pangalawa, dapat approve po yung EC benefits niya. Okay? Aside from that, we also have Kagabay program of ECC. Kagabay stands for Katunod Gabay sa manggagawang may kapansanan. Program of ECC wherein we provide reskilling for employment and training for entrepreneurship. sa mga employees natin. Okay? So for training for entrepreneurship, it's not actually just training. We even provide a starter kit assistance amounting to 20 to 30,000 kung gusto mag-start ng sariling negosyo ng employee natin. Kung hindi siya makabalik sa trabaho because of the work-related contingency na nangyari sa kanya. Okay? So again, all of these benefits, they are on top of the SSS benefits na pwedeng ma-claim ng mga employees po natin. And for the medical reimbursement, if exhausted ng HMO again, and your PhilHealth benefits at may out-of-pocket expenses po yung worker or yung employer natin, pwede po sila mag-file at mag-claim ng easy medical reimbursement. Okay? Alright, so we also have, by the way, financial assistance. Ito, bago lang, yung financial assistance ni ECC. For both systems, yung mga civilian employees natin, aside from the sickness benefit po pala na pwede nila makuha, which is the temporary total, permanent total, or permanent partial disability benefits, once na-approve po yung easy claim nila, pwede po silang pumunta sa office namin para mag-claim or mag-file ng cash assistance. That's 10,000 for disability claims and 15,000 for death claims. This cash assistance, again, is on top of the benefits na diniscuss ko kanina. Yung death and funeral benefits, na 30,000, yung funeral benefits na 30,000, on top pa po yung 15,000 na to. Okay, so maraming benefits actually na pwedeng makuha kay ECs if it's work connected. The key lang talaga dito is dapat alam po natin. Alright, so how do we avail EC benefits now? Paano yung proseso ng filing at claiming kay ECC? All we need to do is fill up yung mga prescribed forms and attach these documents po. Yung certificate of employment natin, proof of job description, medical or hospital records, incident or accident report, and an EC logbook. Lahat po ng kumpanya dapat may EC logbook. Minamandato po ng batas natin na lahat ng kumpanya nagme-maintain ng EC logbook. Okay? Every time I discuss ECC, ito lagi yung concern ng mga employees at employers natin. Sir, hindi namin alam yung EC logbook. Paano namin gagawin yon? Parang gano'n. So, again, responsibility po nating mga employers na mag-provide at gumawa po ng EC logbook for work-related contingencies na nangyayari sa mga employees po natin. Okay? Kung COVID-19 yung case, at least you log in the COVID-19 incident na nangyari sa employee natin sa logbook. Kailangan po siya in filing and claiming for EC benefits. Ito yung itsura ng EC logbook natin. Very simple lang naman siya. Ang content lang naman na kailangan makita is pangalan ng employee natin, kailan nangyari yung contingency, saan, ano yung nature of contingency, number of days na wala yung worker natin sa trabaho because of the contingency na nangyari sa kanya. Okay? I'm aware naman na PMAP will be distributing these presentations to all our viewers ngayon, especially yung mga PMAP members. So, makikita nyo to. Magkakaroon kayo ng copy nito.
Actually, Sir Alvin, even after the presentation, they can still go to our YouTube channel and then still revisit and see your presentation there. Right?
Yeah, pwede naman pala sila mag-screenshot ng presentation natin.
Oh, streaming
Okay, so,
na. Wala rin kami niya, kaya kailangan ko yan.
Okay, so saan ang filing ng EC claim? Ang filing po ng EC claim, para klaro din sa lahat, hindi po sa opisina namin. Nabanggit ko kanina, sa start ng presentation ko, na may administering agencies po tayo, yung SSS at yung GSIS. So ang filing po natin in the private sector, nearest SSS, and in the public sector, nearest GSIS po. Okay? Wala pong filing of EC benefits kay ECC. Magpa-file lang po sa amin, or lalapit lang po sa amin kung nagkakaroon ng denial of claim ng EC benefit claim natin from the two systems. Okay? Yung binabanggit ko ay na quasi-judicial function ng ECC. Pag nagkaroon ng denial, pwede pong lumapit yung employee natin, yung employer natin sa opisina namin if they would like to make an appeal of their EC claim kasi denied siya ng dalawang systems po natin. Okay? The cash assistance, by the way, na nabanggit ko rin kanina, yun po sa amin siya fina-file once approved na yung EC claim natin from the two systems. Okay, so ano yung prescriptive period ni ECC? Ano yung prescription natin for the contingencies na nangyayari sa mga employees natin? Okay? 3 taon po. Okay, so within 3 years, dapat po na-file yung EC benefit claim ng empleyado natin para pumasok pa rin siya sa coverage ng ECC. Ito yung isa sa mga difference ECC from the two systems. Okay? Kasi matagal yung prescription natin. 3 taon yung binibigay sa ating mga empleyado, sa ating mga employers to file and avail EC benefits. Okay? So dapat sa 3 years na yun, na-file naman na natin yung EC benefits natin, di ba? But in the event, for example, na yung nangyari na accident kay employee natin is work-connected, tas hindi niya na-file yung EC benefits niya at nag-lapse na yung 3 years, may tinatawag po tayo na deemed filed. Okay? Once na-file at na-process, for example, sa private sector, yung SSS benefits niya, considered filed na rin po yung EC benefits. So nag-stop na yung prescription natin, yung prescriptive natin na 3 years. So kahit lampas na po ng 3 years, pwede pa rin pong mag-file at mag-claim ng benefits si employer po natin. Okay? Para at least alam ng mga empleyado po natin. Okay? And another difference of ECC from the two systems, kay ECC, first day of your work, covered ka na. Okay? Kay SSS kasi I think you need first to have premium contributions. Pag wala pang premium contributions, you're not entitled yet. Kay ECC again, first day of your work, covered ka na po. Okay? Also kay ECC, you need not to exhaust your sick leave credits. Kasi alam ko kay SSS for example again, you need first to exhaust your sick leave credits or KGSIs before you can start filing for your benefits. Kay ECC, there's no need. So kahit kompleto at buo pa po yung sick leave credits natin, entitled na tayo to file and avail EC benefits. Okay, I think this is the last slide now of my presentations. We always say this every time we discuss EC program. Okay, so the ECP benefits are welcome, but again, hindi na mabiyan ang Employees Compensation Program. Tulad ng binabanggit ni Ma'am Ellen kanina, di ba, wag lang tayo magkasakit or maksidente ng dahil sa trabaho. Importante na ligtas at healthy tayo lagi. Okay? So, in this time of COVID-19, let us always prioritize yung safety at yung health natin. Not just physical state natin, but also mental state natin. Okay? So, napaka-importante na malusog tayo physically and mentally. So, with that, maraming salamat po for inviting us again and for giving us the opportunity to discuss the EC program and our commission to your members and to all our viewers sa YouTube at sa Facebook po. If you have your questions or clarifications, I think we still have time naman to answer ibang mga questions. But just in case hindi masagot, you can find us online. You can visit our website. It's ecc.gov.ph. Or you can also email us. Nakikita naman sa mga screens natin. We are also active on Facebook. Just search for at ecc.official or Employees Compensation Commission. We'll get back to your questions as soon as possible time na makasagot po kami. So again, maraming salamat po.
Maraming salamat, Sir Alvin. Grabe, no? Ako, sobrang enlightened ako. Ang dami palang benefits na makukuha from ECC, no? Parang ito yung equivalent ng insurance kasi, 'di ba? Parang accident and life insurance if you call it that way, no? Dun sa personal life or accident insurance. So sa parte ng gobyerno, merong ECC na pino-provide sa mga employees. You know, this ECC is one of the benefits that we get from the government na medyo taken for granted eh. Kahit ako, medyo, meron palang ganun. So,
kasi hindi tayo nagbabayad. That's why.
Kasi, oo, hindi yun eh. Siguro being an HR person, we're kind of conscious kasi about contributions that employees make or the employers make on behalf of the employees. But the entire coverage, the full coverage, we're not really aware of how much can we get, what can we get, diba? In fact, yung presentation mo enlightened me. As I was going to the office this morning, binabasa ko yung presentation mo, pero pala ganito. So parang, just to share, in my company kasi, we cover our employees 100% full. Wala kaming HMO.
Yeah. Wow.
So full.
Grabe.
Kapag HMO.
Grabe talaga ng MPs.
And the single biggest expense that we have are reimbursements for medicines.
Mm-hmm.
So we really have a tie-up with drug companies because we reimburse.
Yeah.
If you are not able to get a prescription, for example, from our company physician, incidentally kasi ako rin yung nag-authorize, dadalhin lang siya dun sa butika and they get the medicines. Or if something happens during the weekend at wala kang means to secure a prescription from our company physician, then you can buy and we reimburse. Ganun kami. So parang etong area na to, except for SSS, no, na madalas may mga employees kami with prolonged prescription for rest na because they underwent surgery, for example. So consumed na yung leave credit, so they file for an SSS claim. Pero meron pa palang ECC claims, no? Na
Yes.
hindi nakikita. And your presentation is very enlightening. May question pala ako personally because I'm also the managing head of our safety and security committee. Grabe. Wala kaming EC logbook. Pero lagi kaming may incident report. And these are documented. Pwede ba yon? Or kailangan talaga may EC logbook?
Well, wala naman tayong hard rule for the easy logbook. It can be a physical logbook or you can maintain an online system na ini-encode po natin lahat ng contingencies na nangyari sa mga workers po natin. Okay, so better if you have an easy logbook kasi the systems will really be asking for the logbook. Okay?
Okay.
But again, wala naman tayong hard rule. It can be a physical logbook or an online database na mini-maintain po ni company po natin. So long as certify ni management of course na lahat ng information na nandun is totoo.
May nag-comment, maganda daw yung presentation mo.
Thank you.
Very, very informative and very enlightening. Pero may question dito. Most of us are in work from home mode, no? Maraming kumpanya ang hindi nagpapapasok ng empleyado and therefore employees are working from home. May nag-question dito, paano kung wala akong logbook? Walang logbook ng in and out kasi work from home nga ako eh.
Yeah.
So for example, nag-work from home ako, pagkatapos tumayo ako, may kukunin lang ako sa gamit para dun sa ginagawa ko, nadulas ako. Wala kaming logbook nun kasi wala nga in and out. Pero meron akong login sa computer ko. Will that be honored kung magka-claim ko?
It can
Kasi
be on. Yes, especially now, parang yun yung magiging new normal natin. A lot of our workers really will be on a work from home na policy sa mga kumpanya ngayon. Okay? One, we just need to make sure na may existing policy si kumpanya na ina-allow si worker to do a work from home as well. And second, just in case walang logbook kanyan, inform lang po natin yung employer natin, yung HR natin in particular, na may ganong aksidente na nangyari sa atin para at least aware lang din po sila. Kasi most of the time, it's the employer naman, it's the HR who files for easy benefits. Okay, so it's very important that they are aware kung ano yung nangyayari sa atin. Okay?
So folks, yung mga naka-tune in so if you're working from home, may nangyari sa inyo while working, no? While working kasi ang requirement ni EC, you should be working or it's work related for you to be covered or for you to claim a benefit from EC. So kailangan ma-document natin 'yon immediately and we inform our employers immediately who would do the claims for us, who would assist us for our benefit claim. May question dito. I had a car accident in June 2017 and my left arm is permanently incapacitated to perform. I didn't receive any claim from GSIS as support for my hospital bills and expenses after hospitalization. Can I still file for support from ECC?
Okay, if the accident na nangyari kay worker natin is work-connected,
Yes.
June 2017, nag-file naman siya kay
May 3-year prescription period.
Yeah.
So if it's 27, parang malapit na.
Malapit na kaya yung prescription natin. Kung wala siyang na-file kay GSIS na disability claim, okay, at hindi pa rin niya na-file yung easy benefit niya, medyo malapit na yung 3 years prescription natin. So, sana, ma-file niya before mag-expire yung first prescription po natin. We're working on the prescription now, especially nagkaroon ng yun nga, halos work from home yung arrangement natin yan, even as in the government sector, and we're not receiving any claims. Both the systems, I think, hindi nag-receive at hindi nagpa-process ng mga claims ngayon. I'm not quite sure though with the GSIS if may drop box sila similar to SSS na ginagawa. They can leave and drop yung mga documents nila for their claims both for GSIS and both for SSS and EC benefits po. Maybe pwedeng gawin din yun ng employee natin. Okay?
Okay, so malapit-lapit na. So sa ating reactor na to,
Yeah,
yung nasa question, anonymous kasi siya eh.
Yes, pero kung nakapag-file siya ng disability claim kay GSIS, okay, pwede siya mag-file ng medical reimbursement po kay ECC, provided na nakapag-file siya kay GSIS.
GSS, kay GSIS.
Government employee po siya. No? So kung
Correct
nakapag-file,
me if I'm wrong, Sir Alvin. 3 years yung claim natin sa EC. Is it because there is a prescription period of 3 years for money claims? That's a law, di ba? Related ba siya doon? Hindi.
Hindi. Like kay SSS kasi, di ba, for sickness benefit, I think they only give you 5 to 7 days to file your sickness benefit. If hindi siya na-file within that prescription, automatic, forfeited na yung benefits natin. Yung prescription ni ECC na 3 years, it's really in our law, in PD 626 po. Yun po yung nakasaad sa batas natin na 3 years talaga yung prescription ni ECC. Okay.
Okay. May isa pang question dito, Sir Alvin. Is the allowance rate fixed or it differs from different region or with different basic pay? So kasi alam naman natin with the National Wages and Productivity Board, no, iba-iba ang ating daily wage per region. So ang ating contribution kasi is based on our wage rates per region. Ang tinatanong niya dito, iba-iba raw ba yung benefit na makukuha considering na iba-iba yung contributions?
Ang rule po natin doon is for allowance, siguro tinatanong niya is yung temporary total disability, for example, yung sickness benefit natin, 90% po of the employee's average daily salary credit, yun po yung makukuha niya. So, doon po tayo
ulit. Daily average rate niya?
Of the employee's average daily salary credit sa system.
Okay. So, yun. Meron mga comments dito. Hindi naman siya question. Nagpapasalamat lang. Very informative. Very informative. Ngayon lang daw nila nalaman na may mga ganito. First time to hear such a program.
Our Facebook. And check our online videos para at least mas maging aware po tayo about ECC. Again, sabi ko nga, thankful kami kay PMAP kasi for years now, you've been our partner in disseminating information about ECC. So, sana mas maraming employees, mas maraming employers pa yung makaalam about the ECC program.
Rest assured, no? Kasi in PMAP kasi we would like to help also in disseminating this information. The reason why we're conducting this webinar is not only because there's a pandemic and there's nothing to do, but because we would like to give our members as well as non-members information that could help them a lot. Ano? Kagaya nito, I've been an employee for a long time. I've been in HR for a long time already, and I didn't realize that there are other areas in EC that we have not covered. Again, as I said, no, probably because our employees are fully covered, and we ignore this. We take this for granted. Now we can actually tell our employees na you're a member of SSS, or if in the government sector you're from GSIS, you can avail of these benefits, no?
Yeah,
so
yes.
Even if nabayaran ka ni company ng mga sickness or medical and hospitalization benefits, so you can still file a claim for EC.
Exactly. Yes. Yung nabanggit mo kanina, Miss Ellen, like for example, di ba, si MBC yung nag-shoulder ng medicines, ng hospital expenses, ng mga employees ninyo. Pwede actually mag-file si MBC ng reimbursement kay ECC.
Itatanong ko yan sa accounting. Kung nagpa-file kami.
Yeah. Baka hindi
yun.
Accounting, baka mahabol pa natin pumasok sa prescription.
Oo, medyo mahal eh.
You can file also. On top of the HMO and PhilHealth benefits na na-claim nyo na. Yung out-of-pocket expenses.
Andito yung mga staff ko, please take note. Please take note. Kasi it's a big help, really, no? Kasi syempre nung una, our mindset is that, okay, kinover na ako ng company, I cannot claim anymore. Ganun yung mindset eh.
It doesn't work that way. Okay? May mga cases tayo na kunwari nagkaroon ng aksidente sa employee natin, hindi siya nakapasok sa trabaho for 2 weeks. Ganyan, di ba? May mga mababait na employers na despite na hindi nakapasok for 2 weeks sa employee natin, they still pay yung daily salary ng employee natin. Okay? So aside from that, pwede pa rin i-file ng employer yung sickness benefit ng employee natin kay SSS at kay ECC. Again, if it's work connected. Okay, so sayang yung benefits, additional benefits na pwede makuha ng mga employees natin.
Siguro yung si anonymous participant natin, ano, kasi daw with the ECQ and the lockdown and all that stuff, not everybody can go to the office, not everybody can commute, travel, no? Hindi lahat mayroong pass. So sabi niya, it becomes difficult for me. Sana daw makahabol siya dun sa June 2020 deadline because the accident he incurred was like almost 3 years ago, June 17. So habol ka, sir. Kaya pa naman siguro yan. Hopefully,
maybe you can give her my number para at least ma-assist po natin siya.
sige.
I can assist her or him personally pagdating po sa dun sa mga
Wala
questions.
kasi isang name. Siguro kukunin na lang namin and maybe what we can do is if we are not able to read your questions or you have questions later on that you were not able to ask, our professional staff will be collating all the questions and we will be replying via email or via our website. Hopefully, this is not going to be the last webinar with you or an actual presentation from ECC or from Mr. Alvin Garcia. Again, we would like to thank you on behalf of the People Management Association of the Philippines for taking time out from your work. Alam namin, busy kayo ngayon, what with the pandemic. Again, let me just echo and reiterate what we've been saying. Mahirap magkasakit sa panahon ngayon. Bawal magkasakit. No? Even if we know that we're being covered either through the company or via the government agency, just like ECC, wag na lang, 'di ba? Wag na lang. Hindi parang ito yung mga benefit na kailangan mong magkasakit, maaksidente bago mo ma-avail. Pero it pays to know that you're covered. And we're very thankful that there's a government agency that would provide the necessary help just in case lang. So, ulitin lang natin na ito po ay para sa mga miyembro ng SSS at ng GSIS, no? Yung ECC natin. So, kung meron kayong karagdagang katanungan, mga ka-PMAPers at lahat ng ating mga participants, tsaka yung mga nahuli, no? Hindi nakapag-register, you can still view the presentation via PMAP YouTube. You can go to our website also. You can send your questions and we will be glad to help you out, especially during this time of pandemic na lahat tayo ay medyo nahihirapan pero kaya natin to. Sabi nga nila, humanity will go on. Parang we will rise above all these difficulties. I've always believed that amidst difficulties, there will always something good that will come out of it. No matter how bad the situation is, something good will always come out. So, again, thank you. Virtual clap para kay Sir Alvin Garcia from ECC, our Public Relations Officer. And also to Sir Raymond, no? Si Sir Raymond, nasan si Sir Raymond? Nandiyan pa ba? Sir, maraming salamat sa inyo. Very helpful po ang inyong mga presentations. Again, if you would like to know details of the PhilHealth programs, the PhilHealth benefit package, ECC benefits package, how to avail, how to go through them, the basic guidelines, please go to their website. Website po ng PhilHealth, website po ng ECC for frequently asked questions. Makikita po nyo yung details doon. Again, on behalf of the People Management Association of the Philippines, through our President, Ms. Loy Echevarria, the Board of Trustees, our Executive Director, Ide Rene, and all the professional staff who made this possible. Maraming salamat po sa inyo. Let me just end by saying stay home, stay healthy, and stay safe. Good day po. Enjoy the rest of the day para sa inyo. Ingat po tayo.